Hello everyone. Today we are going to simplify a topic that sounds incredible, complex, but is actually fascinating: the classifications of antidepressant drug. To understand how this medicine work, let's imagine your brain is a giant city and your brain cells are a house. To talk to each other, these houses send mail carrier called neurotransmitter. In depression, this specific mail carries run low. The first one is serotonin, which means a messenger for mood, sleep, and happiness. And second one is norepinephrine, which means a messenger for energy and alertness. And the third one is dopamine, which means a messenger for motivations and pleasure. When the person suffer from depressions, this messenger get cleared away too fast before they can deliver their happy message. Antidepressants are simply told that they these help messenger hang around longer. Let's break down the four main classes doctor use today. We don't use this as a first option anymore, but they are incredibly powerful and important to know for the exam. First one is tricyclic antidepressants, and its example is amitriptyline, imipramine, doxepin, dothepin, clomipramine, trimipramine. They also boost the serotonin and norepinephrine, but they are like old and heavy keys. They open the door we want, but they also bump into other receptor in the body, causing the side effect like a dry mouth, blur visions, or drowsiness. Today doctor often use low dose at amitriptyline to help the patient sleep and manage migraine. Next one is predominantly an reuptake inhibitor. It has amoxapine, nortriptyline, desipramine. The most common classes of antidepressants, it's called SSRI. This stands for selective serotonin reuptake inhibitor. Let's break that down into a simple word. Normally that after a brain cell release the serotonin, it has a tiny vacuum cleaner that suck the leftover messenger back inside so it can recycle it. This sucking back process is called the reuptake. SSRI act like a cap placed over the vacuum cleaner. Because the vacuum is blocked, the serotonin is forced to stay outside in the open space longer, bouncing between the cells and boosting the person's mood. The most common example of it is paroxetine, sortalin, citalopram, and fluoxetine. Do you know, guys, why the most doctors choose them first? So they are the very selective, meaning they are mostly target serotonin and leave the other chemical alone. This means they have the fewer side effect compared to the older drug, so they don't work overnight. So it usually take 2 to 4 weeks for the brain to adjust for the patients to start feeling better. The third one is SNRI. So it is very similar to the SSRI, but it does double duty. They are called the SNRI or serotonin norepinephrine reuptake inhibitor. And as the name tells you, this drug block two sides of the vacuum cleaner at the same time, the one for the serotonin, which means the happiness chemical, and the one for the norepinephrine, that is the energy chemical. Its most example are venlafaxine, desvenlafaxine, and duloxetine. So these drugs are for those patients because they boost norepinephrine. They are excellent for the depressed patients who suffer from the extreme fatigue, lower energy, or even chronic physical body pain. Think of SNRI as giving the brain both mood boost and a small spark of energy. So the fourth one is RIMAS. So I have given the formula RIMAS. which means a reversible inhibitor of MAO-A, which means a monoamine oxide inhibitor. And its example is chlorgyline, meclobemide, phenylzine, salicin. Instead of blocking the vacuum cleaner, this drug turn off a enzyme or chemical seizure that chop up and destroy our brain messenger. Mao are very powerful, but patient taking them must avoid the certain food like cheese or chocolate because it can cause a dangerous spike in blood pressure. They are reserved for cases when no other medications work. Our final class is atypical antidepressants. Atypical just mean they don't fit nearly into the other boxes because they work uniquely. So first one is bupropion. Bupropion, it is more fascinating drug. It completely ignores the serotonin. Instead, it boosts the norepinephrine and dopamine because it boosted motivations. It is highly effective for helping the people quit smoking and doesn't causes the weight gain or drowsiness common which other antidepressants. And next one is metrazepine. This one block the specific receptor to force the brain to release more serotonin and norepinephrine naturally. It is known for causing relaxing and increasing appetite, making it a great prescription for the patients who can't sleep or have lost too much weight due to the prescription. Every brain chemistry is completely unique. What works for one person might not work for another, which is why a medical professional carefully choose the classes that matches the patient's specific symptoms. So if this brief classification made antidepressants easy to understand, please click that like button. Leave a comment below letting me know if you want next video to be about the anti-anxiety drug or antipsychotic, and don't forget to subscribe to the channel. Thank you for watching and stay healthy.